Welcome, everybody. I'm Professor Spears, and today's topic is addiction. You probably are very familiar with the fact that addictions is a tremendously widespread social problem, not only in Indiana, across the country, and it's an international problem as well. It actually influences international relationships between countries and leaders and warfare over uh, poppies and things like that are used in the production of illicit substances. So this is a topic that, regardless of your level of experience and interest, it is going to be relevant to you. From the very micro level, maybe you are in recovery, or maybe you're in active addiction and you're using right now, or you have had a family member or a friend who's overdosed. I have had students who have overdosed and did not survive. So this is something that, and for those of you who are interested in majoring in social working and helping people, well, whether you're interested in concentrating in addiction, let me say it that way. No matter what population you work with, having some training in addiction is going to help you be better at what you do. Whether you're working with the mentally ill, got something that we call comorbidity or dual diagnosis. That's where you have a mental illness plus a substance use disorder. It very commonly goes together. At one point in my career, I worked at a homeless shelter. It was always an issue there. And the answer is not simple. Did addiction lead to homelessness, or did the stress of homelessness and the worry of becoming homeless contribute to the addiction or the substance use, or a combination of these things, plus biology, family history? There's all sorts of things that go into this. So it's extremely difficult to think of any social problem that a social worker would work with where addiction is not going to be present. You may think, I want to work with little kids. I want to be in special ed for elementary school. There are going to be parental issues. And on top of that, kids use and experiment at a much younger age than you think. Whatever age you think is appropriate for the talk with your children about drugs, it's less than that. I don't know what your guess is, but I can tell you, I'm pretty confident it's sooner than you think. So I'm very, very pleased to have as my guest today Tracy Traut, who I've known forever, and Katie Moore, who I've known almost forever, a very long time. And I will allow them to, or ask them to introduce themselves, and then we will start our conversation. Would you go first, please, Tracy?
Absolutely. Hello, my name is Tracy Traut. Pardon me. I am currently the program director for the Indiana Professionals Recovery Program. We are a state monitoring program for nurses and pharmacists who are struggling with mental health and addiction issues. I also have a small private practice primarily focused on addictive disorders, trauma, PTSD, done a lot of work with vets. And then I also run groups and do pro bono therapy at the Moraine House, which is a 13-bed sober living facility in Valparaiso. So I a big fondness for that place. It's sort of where I cemented sort of where I was going with my career. I have 2 master's degrees, one from Indiana University Northwest, which is for my LCAC, and then I have another one from Calumet College, which was finishing up, and a bachelor's in psych. Tons of other training and things like that just that go along. But I am very passionate about the field of addiction and the trauma and things that get wrapped up in that. And then the other layers of complexity that happen with an addiction with if you are a non-white person, if you are non-heterosexual, if you are female, those kinds of things, because those issues all complicate the process. And thank you for having me today.
Oh, my pleasure. And I'll say that it hadn't occurred to me until I knew what Tracy was doing with one of her practices. I hadn't thought about how tremendous the need would be for addictions professionals to have that support because they're surrounded by it all day long. There's no escaping it or going someplace where I don't know anybody who's using. People, I'm sure your clients, one text and they could have drugs in probably 5 minutes.
Absolutely. Absolutely.
So it's very valuable, and that's just something that hadn't occurred to me. And I learned that from what Tracy is doing. So next we have got Katie. Would you please introduce yourself?
Yeah, my name is Katie Moore. I'm a certified peer recovery coach on a mobile integrated response team. I also am a recent graduate of Southern New Hampshire University, just got my bachelor's with concentration in mental health. I also am an admissions coordinator for a treatment center. And I think most importantly, rounding it all out is that I'm a recovering addict. I am 3 years, 10 months clean, been in active recovery. And I think it encompasses it all together, being able to use my experience that put good back into this world and give that experience, kind of take away that power imbalance that sometimes like doctors versus clients or doctors versus patients, you know, giving the same ground level of like, I understand, like, although we haven't been through the same things, there are similar things that like being able to relate to and use my experience for positive things in this world versus what it used to be. So thank you for having me.
Thank you for joining us. So what I think I'm going to do first is go over some of the data that shows how prevalent and costly of a problem this is. And then I would like to ask Katie to share some of her story to make it more real. The numbers are absolutely essential. You have to know how big of a problem it is. But then when you hear what it's like firsthand for somebody to go through this, that puts it in a whole other light. And then we'll all be able to talk about, particularly these two, about treatment and how we can focus. We'll see how the conversation goes. But as I said in the intro, this is from the micro level all the way up to international macro level issues. So what are the best approaches? And we will see what our experts have to say, but I suspect that it's going to be a multi-focus approach. We've tried very focused and so that will be part of our discussion. But we've got here I found on this is from the CDC, and it breaks down the percentage of overdose deaths based upon the type of substance. Number one, which probably very few people are surprised by, is opioids. 67.8%, and this is current as of, I think that this was 2021. So it may have changed some, and one of the things that I'm certain that we'll be talking about is how fentanyl has made many of these substances tremendously more deadly than they've ever been before. So opioids, 67.8, cocaine, 21.2%, psychostimulants, 20.6%, and methadone, 4.03%. Now, in Indiana itself, we had in 2022, excuse me, we had 1,677 overdose deaths that year. And we've had 2.59% of all deaths in the state were because of drug overdoses. The overdose deaths increased at an annual rate of 4.49% over the last 3 years. So 5% increase in the fatality of overdoses 3 years in a row. 5% to some people might not sound like much, but when it compounds like that, that's tremendous. And you know that in recent years, it's the first time since the World War that our life expectancy in our country has gone down. And the number one factor related to that is the drug epidemic. Okay, so overdose death rates, it's 26.6 deaths out of every 100,000 residents. That's 28.5% above the national average. So Indiana's not in really good shape when it comes to this.
May I interject
Of
something here?
course.
So one of the things that I always find fascinating when we're looking at data, especially when it relates to substance use disorders, is that alcohol is always left out. So we talk about cocaine and we talk about hair. We're an obsessed nation with heroin. And we have this little triangle, I like to call it. I call it the triangle of the ranking of drugs, right? So alcohol right now, when we look at our nurses, so every month I pull a report. So when we're looking at the data that's coming in, it's a small subsection of nurses, but alcohol most times is our biggest number one, followed by the opioids. And right now, opioids and stimulants are sort of battling each other for second place. But it disturbs me greatly that the CDC is not tracking alcohol, and it's really the way in which we view alcohol in our culture. And so people who come in and alcohol is their only struggle or their primary struggle when they're coming into treatment, they're sort of over here in the corner, right? And we don't really talk about that. So I do want to say that in the last 3 years, those numbers have gone up. We were fighting the drug epidemic in the middle of a pandemic. Alcohol abuse and use, and we don't really quantify it that way because people who pass away with issues of alcohol, they're always more physical issues. It can be also looked at something else, like there was a liver problem, a kidney problem, or they died in cars. So I don't want to be remiss in mentioning that alcohol rates have gone up with alarming rates along with everyone else. So
Yeah,
I will
that's
get
it.
off my soapbox.
No, that is a very, very important point, and it goes to show that the difference between licit drugs, which are legal, and illicit is social definition.
Correct.
You all remember prohibition and how horribly that went. It's because people who had power and influence changed the laws because they didn't want to stop being able to have a safe supply of alcohol. So that's an extremely important factor. And what Tracy was alluding to, being that this was tied into the struggle against the pandemic too, they call these deaths of despair. So it includes suicide, substance use disorder, which obviously alcohol, and then the other things that people define as drugs. And it's almost insulting to say alcohol and other drugs. You
Mhm.
just wish that they would say drugs, like
Drugs.
this one's
'Cause alcohol
legal.
is a drug,
Of
but we
course.
do the same thing with treatment, and I know we're gonna get to that, but then we do the same thing with treatment. Who gets treatment and who has access to treatment is on the same schedule, and that is on the same scale, excuse me.
Yeah.
But it's on the same scale of what your socioeconomic level is, where you came from, and what we're gonna give you access to. So, and I'll leave that.
Okay, and then I'm gonna speed up here a little bit because statistics can get a little bit dry, but CDC also shows they've got a map of the United States, and we are one of the highest prevalence rates of the states and the District of Columbia. The two worst, you may or may not have guessed, are the District of Columbia and West Virginia.
Mhm.
They have, and they have their age-adjusted drug overdose death rates in 2021. DC and West Virginia have a rate between 63.6 and 90.9. And the others really don't even come close, most of them. So we'll see how time goes, but there are a number of factors. It's not just that people in these places are a bunch of drunks and drug addicts. That's not it. There are larger scale issues that relate to this and make it more likely that people are going to resort to substance use. Drug overdose deaths are up 30% year over year. And the key findings that we have here from the National Center of Drug Abuse Statistics is that over 96,700 people die from drug overdoses in a year. 72% of opioids are a factor in 7 out of 10 overdose deaths. And 1 million drug overdoses have killed, drug overdoses have killed almost 1 million people since 1999. And you think about when people rightfully get very upset about death rates in wars and conflicts, you compare them to the statistics of this, and not to minimize anyone's loss, they don't come close. Okay, and then the last thing that I wanted to cover, to Tracy's point, is what are the barriers to getting treatment? And we've got them broken down by percentages. 52% could not afford the cost. 23.8% did not know where to go for treatment. 23% felt that they could handle the problem without treatment. 13.6% had a fear of being committed. 12.4% said that it might cause their neighbors to have a negative opinion of them. In other words, stigma. And 11% did not think treatment would help. 10.6% felt they didn't have time. And 10.1% said that they have concerns about confidentiality. So, yes,
Interesting.
10% thought that their addiction professionals would not protect their privacy. Yeah, that's higher than I thought it would be too. Okay, so you can see that this is a really, really significant problem, and it's multifaceted. And as I always tell my students, if there were an easy fix, it would have happened a long time ago. So this is one of many, many conversations that are probably even taking place at this exact time. But that does not mean that you stop talking about it. You get good people together, you talk it through, and that's what we're trying to do a bit of today. So what I'd like to do, since you put up with all of my numbers for way too long, I'd like to make this a little more personal and human. So you see lots and lots of people are affected. Katie is a tremendous young woman and she's very brave. And I appreciate when we see here in the data that 10.1% of the people won't see a professional who is obligated to keep their secret, don't go to treatment. We've got Katie who's going to tell people that she doesn't know, and she's going to be on my podcast telling people her very personal story. And those who have that kind of courage are an essential part of solving this issue. So with whatever level of comfort you have, I would love it if you would share some of your experience.
Absolutely. You know, addiction for me started out when I was really young. And I think it goes to show a lot, like you said, that, you know, you think of an age of when usually teenagers start using, you know, and you're like, well, there's a teenager, 16, 17, you know, starting, some even 21, getting into the bar scene, going from there, you know. And that was not my story, and that's not the story for a lot of the case. And I think stigma goes into a lot of that of people, you know, assuming the best. And I also think, like, you know, parents, you know, not recognizing that addiction can start off much younger than when society, I think, has painted this nice picture of when it should start or when it, you know, and mine started when I was really young. You know, I moved out to California when I was younger. I moved out when I was in 5th grade. And very soon after that, after dealing with a lot of different traumas when I moved out there, which is usually a lot of people's story is how this starts as trauma. And I went through horrible trauma, and very quickly after that, found using, you know, and of course it starts with alcohol and with weed and with pills and stuff, but it really wasn't that those were the gateways. It really was that the trauma was the gateway to these things. And I started using probably 6th grade. And my addiction progressed very quickly. It was not what you sometimes see in society of like starting, and then like as you get older, it was like, you know, I took that first one and very quickly realized that this was going to be my forever. And I finally found the thing that was going to fix me, you know, because I thought I was the problem. I thought I was the problem, and I found the solution, and that was drugs and alcohol. You know, that was drugs. And quickly, very quickly, you know, the alcohol, the weed, that turned into the meth, the heroin. And by the time I was in high school, by the time I was a freshman in high school, I was in full-blown active addiction, you know, 8th grade, full-blown active addiction. And I went from being like, in the student body, I went from extracurricular activities, I went from being the star soccer player, to quickly plummeting my life at a very young age, and not knowing how to get control of it, and not knowing who to tell, and not knowing how to deal with life on my own. And I think that comorbidity was very true for me. You know, the prevalence of like mental illness in my life and addiction, it was kind of like one of those things like, what came first, the chicken or the egg? And it was like, what came first, the addiction or the mental illness, you know? And didn't know who to turn to, and, you know, caught myself in a lot of very scary situations that just re-traumatized and continued with the trauma in my life. And as that trauma happened, the more I used to cover it up, you know. And then I'm 14 years old and shooting heroin at school. You know, I'm 13 years old and I'm smoking meth, you know, and not knowing who to tell or who to reach out to. And, you know, my parents begging me of being like, you know, I know something's going on. I know something's going on, but what's going on? And oh, nothing, everything's great. How dare you accuse me of doing something? I'm just a tiny little 14-year-old, you know, not knowing that like I'm skipping school to go under the local bridge and do drugs, you know. And that was my life. You know, it was not the normal childhood, you know, and I come from a family who does not have addiction running in their family, you know, but it shows that how badly trauma can completely divert somebody's life. And that was me. And, you know, I found myself when I was 15 years old, and after going through plenty of horrifying overdoses at a very young age, and, you know, getting in trouble at school. I was getting suspended for being under the influence at school. And this is like complete 180 from what my life was, you know, going from star student, athlete, to completely the opposite of having hundreds of truancies for a year, you know, and not knowing what to do. You know, I remember the day that I went into a psychiatrist's office with my mom, because I dealt with a lot of mental illness, and this was back-to-back hospitalizations, mental hospitals. You know, it's actually interesting today, 10 years ago, I was in a coma after a horrible overdose, after dying. And still after that, I remember waking up and being like, God, I'm in a hospital and I can't use, you know? Like that was where my mindset was, you know, and it took months after that. I walked into a psychiatrist appointment and my mom came in with me, and I was like, that's weird, but I was already so high at that point, it didn't even, you know, cause any disturbances. And I walked in and I remember the psychiatrist being like, you know, how are you? How's things going? And things are great. Everything's amazing. Life's good, you know, not telling her that I'm dying on the inside, you know, that I don't have a way out and I don't know what to do. And I'm scared and I'm a kid and this is not how life was supposed to be, but I'm going to die this way. And I'm proud of that at that point. You know, I truly was proud of that and was waiting for that and longing for that, you know. And instead I was like, everything's great. And I remember my mom being like, do you want to tell her? Or do you want me to? Oh, tell her about what, you know? Just tell her about the meth, tell her about the drugs. And I remember being so offended, but so happy at the same time, you know, and I denied it. It's like, I don't know what you're talking about. That's not me. I've never done that before in my life, you know. And I remember on the inside being like, I don't have to do this. I don't have to fight for this anymore. I don't have to live this way anymore. There's still that disease thinking in me, you know, being like, this is my life and I can't stop now, you know. I ended up going to treatment and unfortunately, right after that, I got out and continued to use, you know, and I was 15, turned 16, you know, in treatment. And then we ended up moving out here to Indiana, and addiction continued and my life continued to spiral. And I continued to be like, I went to treatment, so I'm supposed to be better, you know? And everybody in my life thinks I'm going to be better because I went to treatment. And I still remember that aching feeling of dying inside, you know, that continued abuse. And, you know, it all came to a head. And, you know, gratefully I found recovery, you know, and I was in recovery for a while and still not understanding how, you know, well, I'm in recovery now. Why can't I be happy? You know, I'm clean. I've worked an abstinent program. Why can't I be happy this way? You know, and that went on for 2 years. You know, I was clean. I was in recovery for 2 years and I was absolutely miserable, you know, because I thought that somehow the drugs were the problem. And if you take the drugs away, then all of a sudden my life's going to get better. And that wasn't the case. You know, it was my thought process. It was the disease. It was all the other social problems that go into addiction that I was still dealing with. Still didn't know how to talk about it, you know, and I had a pretty rough relapse after that, you know. And I was out for a couple months and I remember coming to the point of being like, you know, I'm either going to kill myself tonight or I'm going to get killed tomorrow. Like, that's it. You know, that's going to be my life. And, you know, and I did. And thankfully and gratefully, I got clean the next day, February 1st, 2020, right before COVID, you know, I got clean. And I remember going through COVID and being like, how am I supposed to get through this? How am I supposed to get through COVID? I'm sitting in my house all day long, you know what I mean? And, you know, after that, you know, it's been a couple of years of me being in recovery. Now I'm able to, you know, work in addictions, you know, and use my experience for good and being able to be a recovery coach for other people who are still battling active addiction, you know, and seeing that every single day with clients and with the community and trying to put some good into the community and recognize that, like, you know, addiction does not discriminate. You know, sometimes people have an idea of what this addict looks like in their mind, and that's just not it, you know. And I think that's that idea and that stigma of society is what hurt me and held me back for so long, because nobody's going to expect your local 13-year-old to be going through that, you know. in a fine neighborhood, in a fine school, we had our problems, but nobody's gonna expect that. Here I am dying, and how am I supposed to tell anybody that? You know, hey, mom, I'm shooting heroin, I need help. You know, and so now I'm
You
here.
said two really things, a lot of poignant things, but two things that were very poignant to me when you started. You said, I knew this was gonna be my forever.
Mhm.
And right behind that, you said, and it was gonna fix me.
Mhm.
And the reason I think those, I'm not co-opting your story, but the reason I think that is so poignant is because the fact that you said it was gonna finally fix me, right? So it's that iceberg thing that you and I were talking about earlier, right? And then this whole thing that this is gonna be my forever, right? So that's where everybody goes off track with this, right? Because it's like, well, it was a choice. Well, you know, it was a really maladaptive decision-making process.
Yes,
right?
yes.
But I think that really gets at the core of it. I was going to fix me, right?
Mhm. Absolutely,
There
absolutely.
probably really wasn't that much. I'm gonna guess trauma is a big deal, but
Mhm.
that's the part nobody got at,
Yep.
right?
Yep.
And you were a kid, you don't know how to talk about that. You don't, like, hey, I have a bunch of trauma here, grown-ups. Can you please roll in the people to help, right?
Mhm.
And so we missed that piece. And then she takes you to the psychiatrist, which, okay. But again, that's more drugs
Absolutely.
that you may or may
Absolutely.
not have needed in that moment because you weren't completely clean,
No,
right?
no, absolutely not.
But that really struck me when you said that this is gonna be my forever and I was gonna fix
It was that idea that like truly this was like a moral thing,
it.
that like I'm just a bad person. And that's why I got sucked into
Mhm.
this, and I don't deserve any of it. And I think that that despair that we talked about earlier, was like that truly is what it was at the core, is that hopelessness and that despair and that belief that I don't deserve this, I'm not worth anything better than this, and that I did this to myself. You know, and having that mindset already and then going through trauma and having that mindset reinforce that trauma. And then you're stuck in this cycle of like, I did this to myself, I deserve this. And then it's like, oh, well, what am I supposed to do? It's like, well, I remember this solution. And that's substances. Then I use substances and then I feel guilty, and then it's just back and forth and back and forth. You're stuck in this rat race, you know?
But there is, I think, in the middle of use, there is a little bit of a respite when the substance is consumed. Even though those moments of respite last shorter and shorter periods of time. And, and everybody's like, oh, you're chasing the high, chasing the high. I think after a while, nobody's chasing the high. We're just chasing that one little tiny moment of respite, right? Where there's a little bit of peace, there's a little bit of tranquility. It's not chasing a high anymore. It's chasing, where's my little corner, the piece that was going to fix me.
Yep. It was those moments I didn't have to think about anything. You know, I didn't have to remember these horrible traumas that I went through, you know, how horribly depressed I was, or anything that I was going through in life. It was like, you know, I used, and then I didn't have to deal with that anymore. And that was my version of peace, you know, and I think that's a lot of people's version of peace. It's like, I don't have to worry about life right now. I can just use, and I'm here, and that's all that matters. You know, the world stops, the voices stop, everything stopped for that quick second, you know, and that's all that mattered. It's all that mattered for me.
I was at a similar type of event as this, and there was an official who was touting their program of medical assisted treatment. And as this person who was really talking about how wonderful and open-minded they were with this new thing that they were doing, they said, they come and they see me and they're junkies. And I wanted to jump out of my skin. How dehumanized that is. And this is somebody who's bragging about how, look at, I'm so humane and I'm allowing these medications to help them, rather than, and this person said something to the effect of, rather than treating them like animals, I'm having them get help through this MAT, and then to call them a junkie. So stigma is very, very powerful. So Tracy, I want to ask you the question, which I know is an impossible question, but it came to mind when uh, Katie was sharing her story. And I'll ask because we will have viewers who come from very different points.
Right.
So when Katie realized that it was a problem and she woke up from her coma, why didn't she just choose not to do that? It was clearly a foolish choice and she almost died.
Right. If we work from the assumption that it was a choice in the beginning, right? So I will back up, like this is not what I went to therapy for. I messed up my life in other ways, in other things. But what I will say is that this is the thing. We always like, it's like when we're handing people in treatment trigger worksheets, and these guys sitting in the front row, this is gonna be old news for them. I hate the word trigger. I hate it. And I'll tell you why, because my background, I've gone to school, I've done all those things, but where I have learned is from those guys who are near and dear to my heart at the Moraine House. Because I've listened to what their experiences has been, and I've listened to those things. And you know, their idea of a trigger is it was sunny and it was 80 degrees, right? So when she wakes up from that, she's already, this is what you know, right? It's like bad self-hatred talk, you know, that you have in your head, right? When your therapist points out to you, wow, you shouldn't be calling yourself all that stuff, and you're looking at him like, why? This is what I do. This is who I am. Her main way to feel better, way to feel connected to self, when you wake up from that, A, you probably don't remember anything, or even that you're in the hospital, and B, it is a complete unplugging of self. It's almost as if when they're in the culture of addiction, they're two different people. They got these two different selves going, right? And so part of coming into the culture of recovery is reconnecting that. We also really need to change our language. And we need to stop treating this as we really like people to be the other in our culture. So we always got to have an other. So what is the difference if you have a chronic relapsing condition that happens to involve alcohol or cocaine or whatever, and I have a chronic relapsing condition called rheumatoid arthritis, which I ignored for as long as Katie probably ignored her addiction. Why? For some of those same reasons. I was in a lot of pain. I was struggling. You can ask the people I work with. I would come in, my hands would be swollen, and I got these gloves on and I could barely work, but damn it, I'm not taking that methotrexate. It's gonna kill my liver, right? There is really in that thinking no difference, right? I mean, I was avoiding something, but we're all avoiding something. And so, yeah, so she goes back to what she knows. No one came in and said, hey, when we come in and we're like, stop it. Why can't you quit? You just put that down. You know, this is ridiculous. You're so young. Your whole life's ahead of you. I hate to tell everyone that is not where they're at. They know what's happening, but this is all you know. And that is safe and it's consistent and it never lets them down. Whereas all of us helping people out here, we are not consistent. We do let them down and we have no idea what in the heck we're doing. Because that it is a letdown. Drugs are reliable, alcohol is reliable, food's reliable, right? Yeah. We start and there's an end.
But we had a first lady with this wonderful prevention program. Just say no.
Yes.
What if Katie would have just said no before she took that first
Right. So,
drug?
correct, right.
So isn't it
what
her
if we
fault?
all, what if we all said, just said no that first time? I will say this for myself as a 6-year-old person. The first time I had a drop of alcohol, I was not of legal age in the state of Indiana. I was not. You know, the first time you really do anything, I mean, you're not. So really, when this begins, we're all making the same choice. We're all in the same boat. We're all out with the friends. We're all at the party. We're all whatever. I will also tell you that the way we approach our children in trying to take care of themselves, you know, my mother was big on, you know, you didn't give your kids any medicine. And I'm like, I asked them how they were feeling. This is when they can speak. And I would say, you know, do you feel like you need Tylenol? You feel like Motrin? My boys would always be like, no, I'm good. If I'm forcing Katie as my daughter to constantly take Tylenol when she's telling me I don't need it, what am I teaching her subliminally? I'm teaching her that the way we fix problems is that we give a medication. And this all seems subtle, and for some of us, it doesn't work out that way, but for others of us, it does. And I was very conscientious about that. You know, like when they both had their wisdom teeth out, they're like, I'm gonna take any, you know, whatever. And I remember calling my brother, who's a pharmacist, and saying, what am I gonna do about this? And he's like, oh yeah, miss, it's your choice. What's happening to you? I hung up on him, but that's but my point to that is, at that point, they're 19. They already knew the effects of this, right? But if we're gonna ask the questions of people in recovery of why did you do this or why did you do that, then we need to ask ourselves the same question. Tracy Traut, why did you drink before you were 21?
And then to build on your point is we now have so much direct marketing of medication in the media to patients. You know, if you feel uncomfortable with this, if that hurts, if there's a pill or a shot or whatever that's going to make it all better. And to
But
do
that
pharma.
also comes with a societal expectation that that we're all supposed to be perfect, that we're all supposed to be working up to our potential, that we're all not supposed to make mistakes, that we're never supposed to feel it. And that is not possible because we live under this philosophy that it's all about pull yourself up by your own bootstraps. There won't be any issues because we do not give people room to deal with what's happened. All we got to do is hold the space. I say it all the time. I do not change people. What I do as a therapist is I sit in a room and I listen to people talk and help them restructure their thoughts and I hold the space. They need to affect their own change, but I need to hold the space. So if we all held space, I realize this is a little altruistic here, but my point is if we all held space earlier, maybe people would feel that the relief did not have to come in the form of a pill or a drink or cough medicine or food.
I think something interesting to note too, that like in my experience, like, you know, this was in and out of hospitalizations I had, in and out of hospitalization, countless therapists, countless medications. I was always trying to figure out like what the problem was and nothing ever worked. And through the whole experience of my active addiction, not one therapist, not one provider, not one doctor after I came out of the coma asked about addiction. Not a single one. Knowing what was in my system, not a single one asked me anything about addiction when I came out of the coma.
Why do you think that is? You got any theories?
I think about this often because, you know, my parents knew that I was using, didn't have any proof. And I'm always told that, you know, when I was in a coma, they were like, what's in her system? What's in her system? They didn't tell them. They didn't tell my parents. And at that point, I had cocaine in my system, I had heroin in my system. And so at that point, an adult could have stepped into my life, you know, and gave me that space and held that space. And I had to continue to suffer after that. Not saying that that would have been the end all be all if somebody stepped in, but it would have offered me some space to get help a little earlier. Not one doctor or anybody said anything. So I always think sometimes, you know, I was viewed maybe as, well, she's just the mentally ill kid. She's just mentally ill, you know, oh, she's just a crazy one, you know, not recognizing that I was going through so much pain and suffering during that time. So I was using very heavily at that point. Everybody just kind of wanted to be like, well, if we just, you know, give her more medication, then maybe at that point she would just stop using. And she's too young. I always got it. She's too young to be an addict. She's too young to suffer with this. She's too young. You still have your whole life ahead of you. So that doesn't really matter right now. You know, maybe that's like an adult problem we'll deal with later. But if we just give her more medication and we just not talk about it, then it's going to go away. And it didn't, you know, so I always think I think the factor of my age and the factor of like pumping me full of different medications to try fixing the problem, then if we just ignore the addiction, that's not true. Everybody, like we just put our heads in the sand, pretend that this doesn't exist, then we don't have to acknowledge that this 14-year-old kid is shooting here.
So in other words, it's more comfortable
Absolutely.
for you to be bipolar, have an anxiety disorder, schizophrenic, any other crazy things we can pull out of the DSM,
Absolutely.
than it is to say, my daughter has an addiction, right?
Mhm.
It's like that great article I read one time, No Casseroles in Addiction. And I'll save you the long story, but basically the guy was telling the story about how his daughter suffered for years in the culture of addiction. She went into rehab, she was doing very well, she was kind of moving through one of those systems where you do inpatient and then you sort of kind of go down the levels and living on the property. And they all been at a meeting. There was a horrible car accident on the way home in the winter, and she was severely injured and in the hospital. The minute she was in the hospital for the car accident, all of their friends and neighbors and family started bringing casseroles. But when she went into treatment, nobody brought a casserole.
And I think that's society's perception of, you know, having something if you have cancer versus having an addiction, that like somehow addiction isn't a disease. You know, like somebody being in a hospital stay for another physical illness, you know, but if I'm in the hospital for a mental illness or for addiction, you know, why is that treated with such stigma? And that's what it all boils down. I think a lot of these problems boil down when, even when we go into treatment and things like that, like it all boils down to the stigma of it, you know, of this like somehow, because I am in recovery, that just automatically means that I was a bad person, you know, and, you know, sometimes it's hard being like, always, oh, well, you went from being such a bad person to now you're good. It's like, that's not accurate. That's not what this is, you know?
Well, and you know, they're not only ignoring the addiction, but they're also ignoring the trauma.
Absolutely.
Of course they are, and they're ignoring a fundamental part of her story as a human being. In the fact that that just like cancer, she kicked its butt. I mean, you ignore a fundamental part of what her story is, which is ignoring a fundamental part of who she is.
Absolutely.
It shaped her life.
And the stigma that's come up already a couple of times is just such a tremendous problem, I think, in a number of ways and levels. But, you know, if you would have been comfortable sharing your trauma and family would have gotten you assistance, I am just conjecturing. It's possible an awful lot of suffering could have been avoided on everybody's
Yes.
part. But we do like to pretend. We don't talk about that. It did never happen, but it doesn't go away just because you pretend. And it's not just family members and society at large that has stigma, but I know a paramedic who frequently gets calls and administers Narcan and brings people back. And this person is very disgusted because they say, I was there 3 times this week and I brought that person back. And
I'm sure he
once was 2 times in one day. I don't even want to go to those calls. This is a healthcare profession, not an addiction.
Oh, I have stories about them too, so.
Yeah. But our paramedic program at Ivy Tech Community College is awesome. So
Well, right.
they, of course, did not go
You
to
know,
our program.
I used to have a shirt that said "Got naloxone" on it, question mark, and I wore that shirt very proudly. And, you know, unless you are really familiar with the term, right? Everybody's familiar with the term Narcan, exactly going to be familiar with the term naloxone. But a couple people would approach me on the street and they would be like, I can't believe, you know, you support that. You know, I don't know what shirt I put on this morning, Don, and then I'd be
Yeah.
like, oh, okay, what are you talking about? But that was the same argument, was that we are reviving, and like, oh, so you just think people should be able to do what they want? And I said, no, I just don't want people to die before they have time to heal, right? So it is a problem, but since you opened the healthcare door, I'm gonna sort of take a little path into that right now when we're talking about addiction, and I mentioned before about treatment. So I have had this huge epiphany in the 5 years I've been working with IPRP. So the way we treat people as they're coming in leaving the culture of addiction and going into the culture of recovery is also very different depending on where you are. So we work with nurses and people who have diverted hundreds of thousands of dollars worth of medication, stealing, not throwing anybody on a bus. And I work at a sober living facility where these guys have had petty theft and their theft charges have been far less. But I can also tell you that my nurses have not seen the incarceration rates, the conviction rates, the pressing charges rates that all of my guys at the Moraine House have had. And that is because we also look at the individual, just like Katie was saying, they couldn't believe she was so young. So there's absolutely no way she could be having that experience, right? Then we'll look at people like all three of us sitting here, people in the audience, nurses, doctors, whatever. We look at them and we're like, there's no way that they can have an addiction disorder. And so that stigma then, when we're dealing with them, it comes back like they can't put themselves in the role of, I may need to be a person in recovery because I didn't have a problem to begin with, right? Because I'm a nurse, I'm a doctor, I'm a pilot, I'm a lawyer, I'm blah, blah, blah. So that same internalized feeling comes right out, just like kids can't have those problems either. And we just keep compounding and compounding and compounding to the point where then who's going to turn and go get help? If all y'all aren't supposed to be doing any of this, then why would you go ask for help? So going back to your question, why didn't she just put it down? Where are they going to go?
I think the healthcare providers provided the most stigma in my life over anybody else. I think healthcare providers, these professionals that were in my life, whether it was principals at schools, whether it was police officers, whether it was nurses at the emergency room, any of these things, even at mental hospitals, you know, like these questions weren't being asked because it was automatically assumed that like, oh, she could be struggling with that, you know. And here's my parents after I came out of a coma being like, something's wrong, I need to know, like, let me know if she's using what substances, and like begging them for help at that point, and still to be denied.
But you know, something that I found, and at first I was shocked by it, and now I'm just saddened and angered by it. But if you look at many of the small treatment facilities in the area, and you start doing some investigating about the credentials of the people who are calling themselves addiction specialists, they have no education at all. No professional training. They have been sober. My hat is off to them. I think that that's fabulous. That does not prepare you to be a therapist. And all of us have biases that we bring to things, and even well-trained professionals, you know, one of the things that we do is we hopefully are always looking for little signs of those biases so that we can combat them. That's part of what you get out of higher education. But I've had students who have come, and thankfully, they've wanted to complete their degree and get their certificate in addiction studies. And as I have them introduce themselves in the very beginning of their training, they say, oh, well, I'm an addictions counselor at XYZ. And, you know, I have immediately write down the name of the agency and who's the clinical director? I'm interested, you know, I'd like to learn more about your organization. And they don't even know enough that I'm doing fact finding, because all of our codes of ethics say that we don't misrepresent our level of expertise, but they don't know enough to know how much they don't know, if that makes sense to you. The more you know, the more you're aware of. There's a lot of gaps in my knowledge. And maybe I need to go back to school. Maybe I need to make sure I check in with somebody who's got more experience and training related to this. But these other areas, I'm pretty good at, and maybe some people come to me, but they didn't even realize I'm keeping track because I want to report people because this is at minimum unethical and it's also illegal. You cannot say therapist or counselor if you don't have a license.
It's dangerous,
And it's
dangerous.
dangerous and misleading. And people put their faith, their personal faith in you. They trust you with their children. And if they only knew some of the people that they were leaving their kids with, they would have never left.
So again, if we were medically treating this and we were medically treating everything the same way, we would not say, if you have a heart problem, or let's go back to my rheumatoid arthritis, right? They're not sending me to someone who's like a rheumatologist light, right? She's actually a medical doctor. So my point is that we take this because addiction has become so big, that we're trying to cheap it down, right? And so there is benefit to everyone being in there, but you cannot ask I hate all these terms, like right now, trauma dump is a big one. And I'm like, okay, but what does that mean? Because that is like so dangerous because we're kind of mainstreaming it, like you just rolled in and you just throw up all your trauma, whatever. If you don't know how to hold that space, you also don't know what you're dumping onto that very untrained person. That could be very scary for them too. And they could have a reaction that they don't necessarily intend to have, but they're very overwhelmed. And then that person is feeling silly. And then the next time we need them to work through their trauma, who in their right mind is really going to feel okay talking about that?
It's true.
And if you're a person in recovery, and I want to point out in this podcast, you have never heard me once use the word alcoholic, addict, whatever, because I am not part of that group. I have very graciously been allowed a seat at the table, and have been very welcomed into the recovery community as a they always call me the normie, the only normie they like, and I'm like, but the thing is that if you've got a person in recovery, my God, they are already dealing with all the I suck demons and the I made all these terrible decisions and blah, blah, blah. And to even get them to crack open that can on whatever that trauma is underneath there is a miracle in and of itself. So again, we are exposing people to things that aren't helping.
Oh, and I think on the top of the list is the bias that we've got in our society to treat people in recovery as criminals rather than patients.
Correct.
We spend, I think it's 4 to 5 times the amount to incarcerate people with a recidivism rate of 85%. So if there was a medication that you took for pneumonia and 85% of the people immediately got sick again, we would not accept that. So there's a recidivism rate of 85%. It's astronomically expensive, but we don't want to pay for treatment because we have judged these people and removed their humanity. Just like that person that I said who was bragging about how wonderful he was and how humanely he treated his junkies. And even going back to the early part of Katie's story, she got caught at school taking drugs. So what did they do? They suspended her. That's the last thing that they should have done. She needed the support. She needed to be speaking to the school social worker. She needed to be put in touch with all sorts of resources and just looking into my crystal ball, I'm guessing you did not spend that suspension sober, did you?
No,
No, of course not.
I already had it in my room. And what's interesting about that is like what you said, like I should have been talking to the social work. That was my second week of my freshman year.
Yeah.
And you know what they did? Not only that, is that the school that I was at, they put an undercover cop in our school and had a big drug bust and all that. And due to my suspension, you know, and the other kids that were suspended with me, we ended up being, you know, the people that they were after. The undercover cop was then put to my art class.
Mm.
Mhm. So instead of getting me to
Also,
help,
you weren't checking any boxes, right? The
Nope.
white,
exactly. And I
You
went
were
to a
well-
predominantly non-white school.
and you were well,
Mhm.
right? I mean, you
And
had
the
some,
soccer star.
and you were an athlete, right? So you weren't checking all these invisible boxes and all of these, because she's like, she's a white upper middle class kid and
Yeah.
she's an athlete. And so therefore, we don't need to check on her, right? She's just being oppositionally defiant, right? And she's just being a teenager, but we're not gonna get to her iceberg. Cause we're just gonna think we already know what your experience is.
It was already created before we started.
Mhm.
It's already created what I was supposed to be and what
Right.
other people viewed me as. That can't happen to her. Look at her. You know,
Mhm.
she's an upper middle class, she's a white one, you know, kid, like, that's not her. She's an athlete.
Mhm.
Not knowing I didn't try out for the high school team because they would drug test me and I couldn't do that.
Right, right. And look at, you gave up something that you really loved, soccer, for this, right? You made a trade, right?
Mhm.
But because right then, this wasn't making you comfortable, I would guess.
Absolutely.
Yeah.
not.
Right.
Absolutely.
You know, one of the questions we always ask is, how much, I always forget the DSM lingo, but it's like a considerable amount of time was spent thinking about using, acquiring, using, you know, blah, blah, blah. And you go through all that. DSM drives me crazy, but it is an interesting question. And I bring it up only because, yes, a considerable amount of time has been spent on all of this. And when we ask you to just and take your little wagon and go to the culture of recovery, it's kind of a lie. Because we've sold this as like, this is nirvana over here, right? This is all nirvana, there's nothing going on over here, it's gonna be all good stuff. And over here, it's nirvana. It's kind of not nirvana, but we also give you nothing to replace all that time and attention and relationships, and we're just like, do this, like it's crumbs. And then we're gonna give you a worksheet on triggers. You can work on that.
And maybe she'd gone from being suspended to now she is expelled. So what
Could
does
happen,
that?
right?
Certainly.
Absolutely, easily.
And then
Absolutely.
what does that do? What motivation do you have to become and struggle to stay sober?
Right.
When you can't get a high school education, that affects your ability to go to college. The criminal history shows up on, the background checks that they're doing on all sorts of jobs that I don't think even should have a background check associated with them. You know, you wanna work at a car wash or something, they wanna run a background check on you. You know, what difference does it make? But it affects the rest of your life, and instead of empowering and looking for what does she need and how can we help her fill that need in a more healthy way? We make her problem bigger and she's got more of an incentive to use. So,
Helping behaviors in this case don't. The things that we normally would think would be normal helping behaviors, they don't help. And we lie, like we lie a lot in the course of whatever. I get accused of being like way too blunt, which I sort of tend to be in my personality anyway. But the bottom line is I've learned a lot is that if I'm trying to spin something and this person is in early recovery, then I have lost all respect, all credibility, because they now feel this is one more time this has been spun. You will get your fanny handed to you for being too blunt, and it's happened to me, and it's okay. But I think that that's appreciated in a different way than the airy fairy spinning this fairy tale-y thing that we're trying to tell you to do.
And I think it's dangerous too, a lot of times when, you know, you get a lot of addiction professionals, especially like you said, who don't have training or anything. They're like, get into recovery, it's this beautiful thing, everything's
yeah.
gonna be amazing, like,
Mhm.
rainbows and unicorns, things are great, you know, and then they get into recovery and they still have to deal with life.
Yeah.
You know, what happens if somebody who is experiencing like homelessness, you know, gets into recovery and they're like, okay, I'm not using, but I'm
on the
still
street with you.
homeless.
Yeah.
You know, like there's so many other social problems that go into this that like recovery does not necessarily mean like that everything in life is gonna be okay. You know, you still deal with the comorbidity rates, you still deal with all these other things. It's just, you know, okay, how do I deal with that without the use of a substance? You know, so I think it's interesting when, you know, there are, like, I know for my role as a peer recovery coach, I do not process with clients. That is not my role. That is not my job. I do not have that credentialing. I do not have that experience, you know. And if somebody were to go with a client and start to process like traumas or things like that, like without that experience, it's dangerous. It is absolutely dangerous.
Well, we are at the point right now where we need to start winding down. But what I'd like to do in the future, because this is such an all-encompassing topic,
Yes.
maybe if my wonderful guests would come back in another time, I would like to have one conversation about micro and family level influences, and another conversation about macro and policy issues related to addiction. I think they need their own hour,
Oh, agreed.
each one.
I think Katie would have a lot to say on both of those. Just,
I
too.
think that you
just
do.
gonna
too.
go with my gut here, Katie.
Yeah,
Absolutely.
I think you may have some opinion, yeah. And that's exactly why I wanted you here.
Mhm.
I know that this is a vast oversimplification.
Mhm.
What were some of the most beneficial factors that helped you become clean and want to be in recovery?
I think the relationships around me, that was a huge factor. You know, the people in my life who were so supportive and so loving and treated me with that kindness and that acceptance, you know, with or without the substances in my life, the consistency of them, you know, and without enabling, but being there for me, I think was a huge factor in they planted the seed of hope. And that way in myself, I could grow that hope and recognize like that despair started to fade a little bit. And even though it faded, you know, just for a quick moment, it was a moment long enough for me to realize that like I deserve something different. So I think that was a huge factor. And also recognizing that like what I was doing, what I was experiencing, that it wasn't the end. There was more out there. You know, there was a life that other people who I love are experiencing, you know, that I know that if I gave myself a chance, I could do the same thing. So I think those were huge. And just not wanting to die. Not wanting to die. Mhm.
And at one point, I know it's a process, but you said earlier
Mhm.
that you almost took pride, in the thought of, I'm gonna die this way.
Absolutely. Countless suicide attempts, countless suicide attempts, countless hospitalizations over and over again. And that, like, I knew that, like, you know, although I'm struggling right now, it's all gonna come to an end soon. You know, and that would be by my own hands. And I was like proud of that. That's what I can control. I can't control me using anymore, but I can't control my life. And somehow I took this twisted pride in that, you know. I don't have to do that in that living versus surviving kind of dichotomy.
Thank you for sharing so much of something that's so very personal. That's very brave to do. A lot of respect.
And we need more people like you, Katie, at the table.
And I'm gonna give you a very vastly oversimplified,
Question?
yes, question. For the lay people out there who have a loved one who is struggling with substance use disorder, what would be some, and I know what I'm asking you to do is impossible, but what advice would you give to a lay family?
Well, I think the most important piece about that goes back to what Katie was just talking about. Stop telling them that they're eventually going to die. they know they're eventually going to die and they find peace in that. So it's learning the helping behaviors that don't normally help, right? We're human beings, we're motivated by weird things, and they're usually bad things, they're usually not good things. But if you look at somebody in active addiction and you're like, you need to stop this, you're gonna die. You know, I think sometimes what they want to really say is, shut up, I know that already, right? They do, and you can't really explain it, so you don't. You just don't say anything. Also, educate yourself. Educate yourself. Go to Al-Anon. Go to friends and family with Smart Recovery. Educate yourself. You will never be able to know what it's like to live in the culture of addiction if you haven't been there, right? But we are human beings and we are capable of empathy. So go educate yourself, find out. And instead of saying, why are you still drinking? Why are you still using? Perhaps sometimes what you need to say is, sometimes you got to set clear boundaries. Like, if you're not ready to go to treatment, then I love you. Call me when you're ready. And sometimes you got to hang up the phone and you got to back away. Because what we tend to do is, if I'm Katie's mom, and I know all this in my head, but I know if it was my kid, I would be doing everything I just said you shouldn't do, right? I'd be shoving you in the door of treatment, shoving you with the therapist. I don't know, making you go do organic gardening, anything, right? But what happens in that helping moment is we just took your process away, right? We just took your process away. So it's learning like when to move forward and when to back up. And I think places like Al-Anon, getting your own therapist, friends and family, Smart Recovery, talking to somebody who's a person in recovery and that is sustained recovery, because they can tell you a lot and they won't hesitate to tell you what you need, right? So you need to educate yourself. And I think we would all be better and in a place of acceptance if we would just A, educate ourselves, and B, be willing to have conversations. But you got to take that other piece out, right? You know, my kids are a really big example of this. I've been doing this a long time and they were little, and they were in middle school out on the basketball court and out in the driveway, and our windows happened to be open. And I heard somebody say something about, I don't remember, they called somebody an addict or a junkie, something ridiculous. And both my kids like stopped the ball and they're like, you don't know anybody in addiction and you don't know what happened to them. And you that's name calling, you can't do that. And in my heart, I was like, right? But the opposite. So what happens is we live in a small town. I'm out. The guys from the rain house, sometimes as much as I love them, boundary issue there. So they're like hugging me, and you know, we have an unusual last name. My son would be working with somebody, but what that gave them is they got away from the other because of the exposure. That was accidental, right? But you also have to understand, quit being afraid of it, that you're not going to catch it, right? Any more than you're going to catch somebody's a different race or they're a different gender or social, you know what I mean? We're not catching any of that. You got to be open to it. And that's what family members need to do. Educate yourself, get into your own process and offer to be stable, right? And consistent and remain open. So, got anything else you would add to that?
I think that's absolutely true.
Yeah, we
Everything
don't,
you just said.
yeah,
Being willing to have the
Willing.
open conversation, just the hard conversation.
and not dictate.
Absolutely. We already lost that control. Somebody else assuming that control isn't gonna help.
That is the perfect way for us to wrap up our episode today. Thank you both so
Very
very